Have you ever wondered why some infections just won't go away no matter how many antibiotics you use? Well, the answer might lie in something invisible yet powerful: the biofilms. And these are slimy protective layers that are formed by bacteria and other microorganisms on surfaces such as wounds, tissues, or medical devices. Now these serve as shields which protect them from antibiotics or the immune system, and this leads to chronic infections, which are infections that last for weeks, months, or even years. Now, but microorganisms don't work alone, because in microbial communities, they live, interact, and communicate with each other. And using quorum sensing, they send chemical signals which enable them to talk to each other. Now, when their population reach a particular larger number, they team up to form biofilms, release toxins, or resist treatment, making them harder to defeat.
Emerging anti-biofilm strategies integrate quorum sensing inhibition, enzymatic breakdown of biofilm matrix, reactive oxygen species production via ultrasound. The use of nanoparticles improve the precision of antibiotic delivery, while combination therapies enhance biofilm eradication. Additionally, surface modification techniques help prevent biofilm formation. This comprehensive approach effectively combats chronic infections such as those associated with implant and cystic fibrosis, reduces dependence on antibiotics.
The emerging antibiofilm therapies. As resistance rises, scientists are turning to enzymes, nanoparticles, and quorum quenching agents, revolutionary approaches designed to break down biofilms, making bacteria vulnerable once again to treatments.
Biofilms account for over 80% of microbial infections and are more resistant to antibiotics. They don't just contaminate the coronary. Additional drugs and surface screening often fail. That's why understanding surface chemistry is critical.
Detecting biofilm-associated infection in the lab is tough. These bacteria stick to surfaces and hide in a protective matrix, making them hard to grow in standard culture. They resist antibiotics and often go undetected. That's why advanced methods like PCR and sonification are needed to improve diagnostic and patient care.
Biofilms are silent saboteurs of modern medicine, but armed with interdisciplinary knowledge from microbiology to lab diagnostics to chemistry, we can expose and defeat them. Let's keep peeling back the layers of microbial complexity, one discovery at a time.